Good evening, everyone. Tête-à-tea session is always special because a lot of interesting and engaging conversation grew over an informal online chat. I, Anubha Arya, SAS Woman of Patna, welcome you to yet another session of Tête-à-tea, which is one of in conversation initiatives of the foundation under its culture and heritage vertical. This virtual chat session undertaken by Prabha Khetan Foundation is organized on the YouTube page of Kahali. Before I introduce our guest, Ms. Parul Khanna Parashar, who will be in conversation with Ms. Advaita Kala, let me say a few words about the foundation. Prabha Khetan Foundation is a name to reckon in propagation of literature, art, and culture. The foundation was established by an eminent literature and cultural enthusiast, late Dr. Prabha Khetan, back in the 1980s in the city of Kolkata. Prabha Khetan Foundation curates best literary and art and cultural initiatives and projects that aim to create cultural capital on the global map. The essence is the soulful amalgamation of the multicultural diversities of India through enriching and stimulating conversations. The foundation enjoys pan India and overseas presence through tastefully curated physical and virtual events. Organized in close association with patron Shri Cement Limited, distinguished associates, partners, collaborators, and SRs Women of India. Tête-à-tea is a unique initiative which takes place on the digital platform of YouTube. Allow me to say a few more words about Tête-à-tea. Tête-à-tea, an engaging cultural initiative of Prabha Khetan Foundation, brews up conversation over a cup of tea. It is a freewheeling chat where notable personalities share insights on popular topic and enlighten the audience with their experiences and knowledge. With Advaita Kala, Tête-à-tea would not have been possible. We are highly grateful to Ms. Advaita Kala for creating Kahani platform and connecting our esteemed audience with eminent personalities from varied walks of life on her online platform that create scope for insightful dialogues and discussions. Today, we have with us eminent personality Ms. Parul Khanna Parashar. She is a psychologist and a passionate advocate of mental health. She is a director of Sanjeevini Society for Mental Health. In conversation with her, we of course have Advaita Kala, who is a notable Indian author, screenwriter, and a columnist. She is also known for writing the screenplays for romantic drama Anjana Anjani and thriller movie Kahani. She is also a novelist and has two novels to her credit, Almost Single and Almost There. During COVID-19 outbreak in India, she ran a community kitchen by the name of Janta Rasoi in Gurugram. Today's topic is quite relevant because men and women find it difficult to manage mental health, dealing with anxiety and fear. So over to Advaita Kala. Thank you.
Thank you so much, Anubha, for that detailed introduction. And I'm delighted that we have Parul with us. Parul, apart from, of course, being a trained psychologist running Sanjeevini, which is a very well known um, NGO that deals with mental health and offers free counseling, uh, is in herself a very compassionate person. And going through the times that we are going through, I felt she would be ideal to talk about this subject with the empathy that is required and is often missing when we discuss mental health in our country. So, thank you so much, Parul, for joining us.
Thank you, Advaita, and thank you, Anubha. It's an honor to be on this platform, and Advaita, your voice will help the message of mental health reach far and wide. So I'm really happy to be here today, this evening. And even if we make a difference to any one life, I think we would have achieved a lot.
Absolutely. And I just want to tell our viewers who are coming on If you have any question, please go ahead and post it on the chat. You're free to stay anonymous as well. You don't have to reveal your identity. We don't need that from you. And we'd be happy to get Parul to address them through the show. So let's just dive right in. Parul, we are a program that focuses on culture, amongst many other things. And today, anxiety has become very much a part of our culture. You read about young children. I know you're a mom of a young girl yourself, of being, having these, going through these episodes, panic attacks, anxiety because of pressure, be it school or be it social media and the validation that they expect from those platforms. What is the landscape like right now for young children and young adults? Let's start with them first.
See, like you've said, there's a lot of factors contributing to an increase in anxiety and other mental health issues in our society because of various factors. I think number one is this striving for materialism and um, the kind of competition that has created. We all want a bigger, better life, and that has a cost attached to it, which is all the pressure that comes with it. Earlier, maybe when we were younger, we had an extended family that we could turn to. Maybe we were living in a joint family, but in recent times, the nuclear family has again, led to us being sort of close to just a very few handful of people in our life. So whatever angst I have, if I have a small family and my parents are really busy with trying to make a career or trying to make ends meet, then who do I talk to about my issues? And later, when we learn what is anxiety, one of the factors that it's repression of feelings, of
Hmm.
so-called negative feelings, sadness, hurt, anger. Um, so also the advent of the social media, while of course we are here because you, me and Anuba are able to talk because of social media, which we wouldn't have been able to earlier, but at the same time it has put an unprecedented pressure on children and young adults who are far more impressionable, whose personality is forming. So there's so much of people seem to have nicer lives than we do, so that also puts pressure, plus this need for validation, which maybe earlier in the family was being met, but now we are depending far more on our peers and friends. So when they don't like us or they exclude us in some way, that again leads us to feel a certain way. Um, which we may not sadly be able to talk to anyone about because we don't want to cause stress in the house. So there's so many factors, I think, Advaita, that have led to um, um, anxiety going up. And in recent times, I think COVID couldn't have helped. Although I'm yet to see any study on the long-term effects of COVID, but intuitively, COVID couldn't have helped. This isolation that we all were dealing with, where our normal avenues of meeting people, of pursuing our hobbies, of relaxing were cut off. Our uh, for a lot of us, there was a job loss,
Hmm.
sadly, the death of near and dear ones, and just generally so much of angst that we were all dealing with at various levels. Obviously, must have also impacted mental health of people in general.
Yeah, yeah. The other thing that I was curious about, Parul, is that, life is about going through a series of different circumstances and also a series of different emotions. So there are going to be moments when you are anxious or fearful or depressed even. It's natural. It's a part of being a human being. How do you make the distinction between experiencing human feelings as opposed to actually having a condition, so to speak, wherein you need to reach out for help? Because a lot of times your friends, your family, or people you confide in may say, oh, come on, go get a drink or go out and watch a movie, or spend some time with your friends and you'll get over it. So how do you know that this is a little more than just the blues, so to speak?
So I think you rightly said that some amount of anxiety and fear in life is natural, it's inevitable. It also helps us, right? If we didn't feel the pressure of that exam or that deadline, how would we stay motivated? It helps us also identify if something is not working in our relationship or in our work or in any other situation. If you're feeling anxious, then it's time, it's like a signal that it's something that you need to work on.
Mm-hmm.
So it's also a motivator for change. And so that is natural, inevitable, very much a part of modern society. If you're staying at home and not meeting anyone, that in itself can cause anxiety, right? Going out can cause anxiety, anything. But there is a difference between, let's say, because today the topic is anxiety, there is a difference between what is normal anxiety, what is natural anxiety, and what when it is termed as a disorder. And this difference is very important to understand, because a disorder is something where which is more serious in nature, the reason being that it lasts longer. So when there is anxiety, it might go away when the situation passes, right? When the exam passes, or when that travel passes, or whatever is making me feel anxious passes. But when it's persistent, it's staying on, its effect is more intense. And I'll describe what intense is.
Mm-hmm.
And it's actually affecting our daily functioning in some way or the other. That's when it is termed as a disorder. So how do I know that now I have
Yeah.
crossed the borderline between the threshold between normal anxiety and a disorder?
Yes.
Is number one, that it has an impact on me physically or physiologically. So I have, and this is for a persisting period of time. So maybe, on the body, it's showing in the shape of headaches, a heart pounding, feeling pain in the body, palpitations. So it's
Mm.
affecting my body, right? And for a persistent period of time. Feelings psychologically, a feeling of dread, a feeling of unease, a feeling of helplessness, hopelessness, self blame. So this is when, and these feelings are again persisting, because momentarily or for some time we can all feel this way, right? These are normal human feelings, but these feelings are now persisting. And finally, when it is affecting us, our behavior, so sabotaging our relationships, sabotaging our work. I need to travel somewhere, but I'm scared of that aeroplane, and I need to
Yes.
take flights, right? So it's coming in
Mm.
the way of my work. Sabotaging relationships, maybe I'm obsessing about something and sharing that with my partner all the time, and that's having an impact on my
Mm.
relationship. It is affecting my productivity, because if my mind is racing all the time, how will I concentrate? How will I deliver? Um, it is making me maybe inappropriately and excessively use alcohol, drugs, smoking. So, this is the point where it's reached into my behavior. So, you see, it's affecting a person's whole being. It's affecting me physically, it's affecting me psychologically, and then it's affecting my behavior as well. That is when it has become a disorder that now needs attention and needs some intervention.
Mhm. And how getting people to that point also, where they feel like, okay, I have an issue and I need to get help, is also a bit of a challenge, isn't it?
Absolutely, because asking for help for many is a sign of weakness, maybe. If I have a belief that I have to be strong, I have to be independent, asking for help is shameful, I have to manage on my own, then of course, naturally, it's going to be very hard for me to reach out and speak about my problems, because I consider it weak. So it's
Yes.
a big belief system also that comes into place.
And Parul, what have you noticed in the many years that you've been, counseling? What are the changes that you've noticed in society in general? Have people? One is, of course, the demographic changes. Have people become younger? Are you getting younger people coming in for these kind of issues? Second is, of course, society is changing, lifestyle is changing. So, what are the new challenges? One of them, of course, like we discussed, is social media pressures. But what are the new challenges that are coming up for people?
I think what I have recently been observing, and again, I don't know, I have not, I don't have data to back my belief, but what I've recently been observing is that a lot of lifestyle issues are causing us to feel more anxious. So I'll give you an example. Like, stimulant and recreational drugs. There has been a huge increase in the intake of those, whether it is weed. So a lot of young people will say, "Oh, but weed is natural." Sadly,
Yeah.
it's not natural. Maybe in the 70s it was natural, but now it's all been tampered with. Other narcotics, MDMA, cocaine, um, smoking, vaping. These are, adding to a general feeling of an anxiety leading to a disorder that I have seen a huge change in the last 5 years.
Wow. I didn't realize that this was it was that endemic. Of course, one hears a lot about recreational drugs and this whole culture around it, but I didn't realize that there's a direct connection to anxiety. You usually think of it, Parul, in more physical terms, like you'll have withdrawals if you quit, or you can OD. But the mental health aspect of it with drug use is not something that we discuss, and maybe we should discuss more.
Should. In fact, even withdrawing from narcotics or withdrawing from alcohol can lead to anxiety because earlier, maybe I was using it as a coping mechanism. But when, for due to various reasons, which could be health related, could be financial, could be I've hit rock bottom in my personal life, I have to
Yeah.
withdraw. And that in itself could lead to an anxiety disorder if it's not managed appropriately.
Hmm. And how important is a routine in these situations? Like, how does that help when you have a routine, when you have places to go to and things to do, so that it takes you away from these kind of thoughts?
Absolutely. A routine is very helpful because it is something you can control most of the time. And when you're anxious by nature, then um, a lot of times you feel that things are not in your control, that you're not being able to cope, so that you're a failure. So when you have a routine that you can adhere to, that you can manage, then it gives you that feeling of accomplishment that definitely would help your anxiety.
Hmm. I think Deepa's also come up with a very interesting comment about the projection that we have, and we live in a society and a culture now where access to entertainment is 24/7. Gone are the days when you would have Chitrahar at 6 p.m. or the Sunday evening movie. Today you can watch things on demand. What role have you noticed has the mainstream media, and this I mean news, entertainment media, all kinds of media, social media, played when it comes to the portrayal of mental health issues and dealing with them?
That's an interesting question. So, first, I'd like to talk about coping with anxiety and how um, we are not always coping because then, a very important way to address anxiety is to relax. But these days, we are constantly watching something, consuming social media, consuming OTT. So, there is no time to relax and rest, and that in itself also adds to anxiety because
Yes,
being
so true.
rested is also very important, right? But if we are scared of feeling rested, we are scared of these thoughts that we have, we don't know how to cope, then a very natural way is to distract oneself by consuming an excessive amount of media. So that
Mm-hmm.
in itself is also actually adding to this lifestyle that I had earlier spoken about. So recreational drugs is definitely one of them, but also an excessive and inappropriate consumption of social media and OTT platforms is also adding to us feeling more anxious than we ever did in the past, because back then it was that one chitrahar which was the highlight of your week.
Yeah.
Whereas you had much more routine based life. You got up at a certain time, you slept at a certain time, there was a certain amount of recreational activities. So nothing was as excessive as today we have
Hmm.
access to, and it's very hard to control if you're not mindful.
Yeah. No, I think I have this problem also. I consume a lot of content online, and all the time, like a lot. And I think you hear often with parenting skills and all of those things. Sometimes you say screen time. Limit your child's screen time. How important is it for adults to limit their screen time?
Absolutely, because children don't do what they we say, they do what they see us doing. So if we are
Hmm.
going to be on our phone all the time, if we are going to be watching something all the time, then from it's hard to kind of get them to see the the cost attached to that, because it seems so natural, it seems so a part of the family's routine. Then with which face do we tell our children not to do it?
True.
And
And
Advaita, you asked another very good question, which I want to address, is portrayal of
yes,
mental health in media.
yes.
And I have to say that it's not that understood. So very often you will read that a man burnt his wife because she gave him a cold roti, or
Hmm.
a man was in debt and he poisoned his entire family. Of course, there were those external factors, but the fact is that the person may have been dealing with some serious mental health condition, because a lot of other people may have financial issues, may have lost a job, may have had some other very life altering event, but they are not um, acting out in this way, right? So instead
Yeah,
of focusing on the reasons that could have led, possible mental health reasons that could have led to such unnatural occurrences, the focus is on the details of those occurrences, to
hmm.
sensationalize it and to make it more
Right.
appealing. But I do feel that mainstream media can play a big role in creating awareness. So I understand this is your business, you need to sell papers, you need to sell your websites, but at the same time, if you could link, if you could keep that part of it, but also have some element of mental health attached to it, seek help, then I do think there will be a more appropriate portrayal of mental health, and people will become more aware and maybe start seeing red flags before they become, um, really
Issues.
sad issues
Hmm.
that people act out with.
Hmm. So that's asked a question, Parul. He wants to know that how can you help somebody who is in depression but they are not open to discussing it with the family?
So, Siddharth, I say this with sadness, but you can only help those who want to help themselves. So, of course, you can be, um, but I can tell you what not to do. What
Hmm.
not to do is to say hurtful things, to call them lazy, to call them, to call them not wanting to help themselves, to ask them a lot of questions when they may not have the energy to address those questions. Uh, and definitely you can give them a listening space. But if a person is not interested for whatever reasons to seek help, it's hard for other people watching, but there's very little you can do till a person realizes the impact on their own life and then does something about it.
Hmm. Shabir Ahmed is asking, how do you relieve anxiety? I think that's the main question. How do you relieve it? Is medication the only option? What?
So
How do
I
you
would say
deal?
that medication is one of the options, but I would like to talk about simpler things before we
Hmm.
get into medication. So one is that a lot of anxiety is because of withheld feelings. So we are culturally told, maybe in our childhood we picked up messages that it's not okay to feel angry, it's not okay to feel sad, it's not okay to talk about your problems. So we
Hmm.
start repressing and withholding those feelings. But if we find ways, if we find a trusted friend, somebody who can, keep our matters in confidence, or we journal. So if we start expressing our feelings, it definitely does help relieve anxiety. We engage in experiences that make us feel better about ourselves. That also gives you the confidence and reduces anxiety. It could be engaging in some hobby, it could be engaging in some relaxation activity, anything that is helping you tell yourself, I am valuable, I am worth investing in, definitely helps anxiety. And then, of
Hmm.
course, back to the basics, cannot specify enough about the importance of good sleep,
Hmm.
nutrition, exercise. These are just, I mean, it's very intuitive, and they help
Hmm.
our physical health too, but they definitely help our mental health as well.
I think he's expanded a little bit on his question. Is that with this, he when he has anxiety attacks, there's nausea, there's chest pain, shortness of breath. So these physical symptoms, that manifest. How do you cope with that?
See, there's not, it's like anything else, anything physical. um, you have to, it's a comprehensive approach. You have to
Hmm.
take care of, so what it seems like he's describing is like a panic attack,
Panic
which is a
attack. Yeah.
form of anxiety. So
Hmm.
the way to address it is the same. Take care of your physical health, sleep routine, exercise, nutrition. Make yourself feel good
Hmm.
by hobbies or by relaxation. Discuss your feelings either by journaling. So, any form of anxiety is helped through the same means, which is a comprehensive approach. Working on your emotions, working on your body, that is what
Hmm.
will help a panic attack as well. And of course, when you've tried everything and nothing is helping, then please definitely approach a mental health professional. It could be a psychologist, it could be a psychiatrist, but don't let it go unaddressed for too long, because like anything else, if you have diabetes and you don't
Hmm.
take care of your sugar, then it starts affecting your eyesight, it starts affecting your movement. So same way, the more we neglect our anxiety disorders, they will start slowly taking over our life, physically, emotionally, behaviorally. So one
Hmm.
takeaway would be, if anything comes out of this talk, one takeaway would be that don't neglect what you're seeing within yourself. Address
Hmm.
it.
Yeah. I mean, sometimes in the news, one reads very disturbing things or very disturbing incidents happen. We live in very violent times, and we live in a 24/7 news cycle. And I find myself personally, and I know like a lot of other people, getting really deeply impacted by these situations, and not feeling like you really can't do anything in concrete terms, because after all, you're just one person, and you don't have the access to actually do things that can change situations. How do you make sense of this? And this is for adults, and more so for children who are also getting exposed to this, and there's no filter. Earlier, there was only the newspaper or the 9 p.m. news or something like that, but now on the internet, on TV, I mean, everywhere you have to face this.
So I would just say, Advaita, that we need to go on a social media oblique news diet.
Hmm.
Like food, it's important, needs to be consumed. The same way, it is important to keep abreast of what is going on in the world. We can't live as recluses. We need to know. But at the same time, anything in excess is not healthy, is not appropriate. And when we are seeing that it's affecting our mental health, it's leading to the helplessness that you described right now, that I can't do much, then it is time to, it's a signal to yourself that I need to set some limits to the amount I'm consuming. And then again, secondly, I would say that we all have things we can control. So you're one person, but look, today through your channel, we are talking about such a prevalent topic which might help lots of people. So everyone has something within their control. You are, of course, you have this voice and this platform, but maybe others have people in their family whom they can talk to, whom we normally don't have time for, or call that old long lost friend that who's going through a tough time. So everybody has somebody they can help, everybody has somebody they can reach out to. It may not be the victim in the news, but it may be people in your own life.
Hmm. No, no, absolutely. And I think that we're doing so. I remember there was a time when you would actually, I think earlier generations would visit someone on their birthday. Then I think our generation started calling
And
people
maybe
and
the
wishing.
previous generation, I mean, the next generation is just putting out a message, right?
Yeah, yeah. So
Yeah,
now
like
they
some
now it's
Instagram
very,
post or something.
yeah. So, I think we are also talking to each other less because we're much more comfortable just texting. I don't know about you, but I am definitely, I don't know, Anuba, even if you are just more comfortable texting people than calling.
That's correct. We
I
do
think we're
prefer
all getting into that
more.
space. And
Yeah.
again, I would say COVID may have also played a huge impact in, because
And
2.5 years of our life, a lot of things changed.
Yeah, yeah. And some people are not sharers, right, Parul? I mean, some people don't like to share. And is this something you've noticed as a gender thing? Like women are just more open with sharing, and our society tells men that be strong and boys don't cry, and don't go. Being
Absolutely.
boys talking about their emotions is considered very kind of unmasculine, so to speak.
So even
How do
in
you?
the NGO where I work, 70% of the people seeking help are women, because of
Yeah.
the very reason that you mentioned, that women find it easier to ask for help.
Hmm.
It's not always a quotient of their strength, whereas for men, it is a sign of weakness that they find in themselves if they feel they can't cope.
Hmm.
So
Hmm.
definitely you are right, and therefore it puts so much pressure on a person if you can't even talk about your problems.
Yeah, yeah. And what do you think of these sort of? I know in the West it's happening in a big way, and it's interesting to me that they have turned to our ancient traditions with a much more passion than we have. Be it yoga or be it meditation, transcendental meditation is huge, and it's really helping people cope with their lives. How much of a role do you think these things play? Apart, of course, I know. I mean, you're a practitioner, so you do the cognitive behavioral therapy, and you have all those techniques, talk therapy, and then there's medication as well. But what do you make of meditation, yoga, mantras? That kind of chanting. Anubha, I'm sure you do a bit of chanting, being a practicing Buddhist. What do you make of that?
So these are extremely helpful breathing exercises. So anything that goes into helping your body relax, whether it's pranayam, whether it's deep breathing, whether it's abdominal breathing, whether it's meditation, anything that is helping your body relax and you're doing it as a part of your routine will definitely help you address your anxiety.
Mm-hmm.
And you are right that the West has taken to it in a big way, and I do see much more awareness today than maybe it was there earlier. So the more we have dialogue, the more we talk about these issues, the more we talk about a healthy lifestyle, because a healthy lifestyle not only helps your physical health, I have seen how significantly it helps your mental health as well. So there's such a correlation between the two, that the base of a mental of good mental health is good physical health. Because if
Yeah.
you're struggling with physical illnesses, diabetes, blood pressure, cholesterol, other more serious illnesses, then of course it's going to be harder to preserve your mental health. So the basics is always where we need to start from if we want to make a change in our own lives.
And it's a horrible thing, and India is really suffering from it. But we've seen an increase in the number of suicides, and according to some metrics, we do have a lot of young men actually who are very vulnerable to this. What are the signs that you one can pick up on as just no, I mean, we're not professionals, but just human signs that one can pick up on to know that a loved one or a colleague or a friend is in some sort of mental distress?
So, a change in their sleep pattern, that they're
Mm-hmm.
sleeping too much or sleeping too little, a change in their eating pattern, eating too much, eating too little, a change in their behavior. They are withdrawing from activities that they earlier found pleasurable. They are, in general, isolating themselves. An increased use of some substances, narcotics, alcohol. Um, Also, one finds if one finds that a loved one is giving away possessions, or talking about making a will, or just talking about life being worthless, of or expressing hopelessness,
Mm-hmm.
expressing helplessness to make a change. So these are some of the signs that the kind of red flags that we must work on if we see it in a loved one.
But what if they're resistant to help? Like I know someone who is very resistant to help, but is also very open that they are on the edge. So then it becomes very difficult
It does
for
become
someone
difficult.
who wants to help them, apart from just checking on them.
And that also is very powerful, Advaita. Checking on somebody, asking how they're doing, telling them you care through your actions. I think that also is very powerful. But till a person doesn't want to, because if you've reached this level, means now there is the need for a mental health professional to be consulted. So if you're not willing to do that, then as per the Mental Health Act, no one can compel you to. You have to be seeking that help yourself. um,
Mm.
so but being there for the person, giving them understanding, warmth, empathy also will play a big role in maybe help, making them seek the expert help that they so need.
Part of the other thing I want to ask you is how do you identify that you're in a toxic work culture or in a toxic relationship? It could be a love relationship, it could be a family relationship or a friendship, but it's toxic and it's impacting your mental health and your self esteem. How can you, maybe the person is a narcissist, for example, and there are many of those walking around. How do you protect yourself? It could be a very intimate relationship where you don't have the option of cutting away. If it's a friend, sure, you can stop communicating, but if it's a marriage or a parent or a sibling, how do you deal with, or a work situation, a boss, how do you deal with that?
I think the number one thing is awareness. Being aware that I am deeply uncomfortable and it's impacting me. Maybe it could be physically, it's impacting me emotionally. I am feeling uneasy around this person. I'm feeling like I'm, fearful around this person, or I'm feeling like the need to protect myself around this person. And watching my own behavior as well, that when I interact with this person, I feel like I don't feel very good about myself. I feel like isolating myself. I feel like my energy is drained. So I think just listening to yourself is, and acknowledging it to yourself that I am deeply uncomfortable, there is something wrong in this relationship, would be a huge first step. And then putting appropriate boundaries around yourself, which is easier said than done, of course. But once you acknowledge, once I know something is not good for me, for whatever reason, then that awareness in itself will help me protect myself better.
But society then gives you the entirely different cues. If it's a marriage situation, someone will turn around and tell you, at least he's not beating you up, or
Hmm.
you're, at least he's a good provider, so you deal with it. Maybe he's short tempered or possessive, or doesn't give you time, or whatever the may be the issue. Society is always telling you to hang in there. Don't quit. So, how do you make a balance between these two situations?
See, you can't change the belief system of everybody around you. And if you try to do that, you'll always feel let down and disappointed that nobody understands me. But there could be that one person in this world that you could share your feelings with about how you're feeling around this person because of this person. And if you get some amount of understanding, even from that one person, perhaps you get that validation that we all need. Validation is also a very strong human need. So if everybody is telling me that I need to make this relationship work, I am feeling a different way, and because of maybe my circumstances, which could be financial, which could be emotional, social, whatever, I'm not able to leave. Just acknowledging to myself and having a safe confidential space, which could be a friend, which could even be a therapist, I think will make a big difference to my mental health.
And I think it's important to point out here that what the work that you do at Sanjeevini is free of cost. You have to book an appointment, of course, and find your way there. But there is a lot of help that is available where you don't have to pay, because a lot of people get intimidated by the expense factor also involved. And unlike a physical condition, mental health doesn't show on your face or your body. So, you look fine, but you could be going through a ton of things. And I think Siddharth asked another question, I think related to what I had just asked you, where he's saying that you often hear that anxiety and stress make you stronger. And if you're too relaxed and calm, then you're somehow going to lose out on the race of life. And it's true. All our films, our media, our elders, they all tell us that, fight it out, hang in there. But sometimes you just have to say, no, I choose me.
And like I said, that some amount of it is not wrong. We all need to find that zone in our life where we feel motivated, where we feel excited, where we feel that that amount of stress is helping us move ahead. whether it's emotionally or physically or financially, whatever it is that drives you. So if we all find that zone where there's that right amount of stress, and it does exist, then we will feel more motivated. But if people are telling us or society is telling us what that needs to be, that's where the issue arises. If
I
I
think what
enjoy
I'm hearing,
writing, but I'm being made to, I'm feeling compelled because of the messages I receive that I need to do science. Then, however much I try and put an effort in science, maybe it's not for me. But if I continue with pursuing writing, then maybe it doesn't feel like a burden. It doesn't feel like that pressure. So it's important to again have awareness about what it is that motivates you, because that will not seem like a burden.
I think what I'm hearing from all that you're saying is that it's important to have a conversation with yourself. Know
Absolutely.
thyself, you know,
It's
and
absolutely, and watch your inner dialogue. What is your inner dialogue telling you? Is it telling you you are useless, you are a failure, you will not be able to cope? So, if that is the kind of inner dialogue that you are constantly dealing with, then you have to also ask yourself that if you had a friend like this, would that person truly be your friend? Who's constantly discouraging you, constantly demotivating you. So then, but are you being a friend to yourself? So that is what I think in any situation, it's important to ask yourself that what am I telling myself in this situation?
I know I heard one beautiful quote which said, "Don't take more than what you can carry," and or want to carry really, because and this just doesn't have to do with taking on stress, but even like when you say, "Is financial success your goal?" Now, do you need to be a billionaire? Do you really need all that money? Right? Or do you need that money to have a good, comfortable life, have good medical help when you need it, be able to educate your children? So I think, one has to set parameters on their goals as well. Otherwise, you're just going to drive yourself into this cycle of competing with other people, of comparing yourself, of setting unrealistic goals, then being disappointed in yourself
And
because you haven't
constantly rejecting yourself, right?
constantly rejecting yourself. And we all do that. I know I have done that a lot.
I think, yeah, we
Anupam,
all do that
yeah.
because, and that's also okay, till you don't want to make changes in your life, it need not be at the cost of rejecting yourself, but it's also important to reflect on yourself. None of us is perfect, and growth means making changes in our life, pushing ourselves to some extent. And if that is missing, then that is another disorder. If you have no space in your life for reflection, you think you are perfect, others are beneath you, that in itself is an issue, right? So some amount of self depreciation, questioning oneself is important, but it is the extent to which you do that.
And also, I think my last question for you is this also, finding your tribe, finding your fellow travelers. I think because of this influx of social media, because we travel a lot more, we have busy working lives, we have more social events. How do you identify who your tribe is? What are the signs that you should look for? Because I think if you're surrounded by the right people, a lot of these issues like anxiety, depression, they may not resolve 100% because there's enough evidence to suggest that these can be physiological and genetic, etc., but they can certainly be managed very effectively. So how do you find your tribe?
Again, Advaita, I mean, I just keep repeating it, but I'll repeat it again, that listen to yourself. Who are the people who where you feel warm with, where you feel comforted by, where you feel supported, who celebrate your success, who understand you? So I think, if and you will tell yourself who those people are. Nobody else needs to tell you. You will pick up those signs from yourself, and if you listen to those signs, you start really being a friend to yourself before you can be a friend to others. I think you will find your tribe.
On that optimistic note, I'm going to hand over to Anubha in case she has any questions of her own. And go ahead, Anubha.
Uh, Parul, first of all, thank you, both of you, for this very insightful, very helpful, and informative session. And you know what? I want to, viewers who want to reach out to you, to your NGO. So, do you have a phone number or a website? So, if so that we can share it with our viewers, and you
I
could,
can share it with Advaita.
yeah,
The place where I work, we have a huge wait list because obviously the supply is more than the demand. I mean, the demand is more than the supply. Sorry.
I know.
But definitely you can call and register your name. We have a wait list. It will take some time before you get your turn. There are also lots of other helplines and other
Exactly.
NGOs. The government has also started one, which I believe is 24/7. So for
Mm-hmm.
those of us who need help, it is available.
Share those links as well with
I will.
Advaita.
I will
Yeah,
share with
that would
Advaita.
be really helpful.
Will do.
And, and of course, your tips, like what you talked about, having a routine, which is so important to fight anxiety and fear. So, having a good routine and to have a good diet also plays such an important role. So, all that was very insightful, and I thank you, both of you, again. And do we have any more questions from viewers? If you want, you can ask Parul. We do have time. So, we have one from Deepa Mishra, I guess. Do you think a person with mental health issues can influence others to follow them into taking extreme steps? For example, the Burari case.
It sounds like that at the surface of it, that one person influenced the whole family to take certain actions.
Yeah.
But since I don't know the details, it's hard for me to say what really led to this tragic incident.
Parul, that leads me to one more question is that, as a caregiver of someone who's going through mental health issues, it could be a child, it could be a spouse, it could be a parent, sibling. How do you take care of your own mental health? And even for you, as a counselor who's listening to this day in and day out, how do
Yeah.
you kind of pull the plug and say, this is my mental health needs are this
Anupam.
without giving up on people?
I think self care is the key. Same thing that goes for anybody else. Um, if my pot is empty, how do I give anyone else water? Or if my car has no petrol, how do I drive that car? So till I'm not able to take care of myself, how will I be able to take care of another person? So I think the key to being a caregiver of any sort, whether it's to your children, whether it's to an elderly parent, whether it's to somebody living with any mental or physical health condition, is that first you make yourself physically and emotionally resilient. Because without that strength, how will you take care of somebody else?
Hmm. It's like that airplane analogy, right? When the air hostess says, first put on your own mask,
Mask,
oxygen mask,
absolutely.
and then mask up a
Yeah.
child or an
Even
elder.
your own child, right? Who can be dearer to you than your own child?
Yeah,
But if the
exactly.
air hostess is telling you that, it's because if you're breathless, you're uncomfortable, you are struggling, how will you help your child?
So true. And I have to let you go now, but I'm just going to ask you five mental health hygiene tips that we can all follow in our lives so that we don't get to a stage where we're left grappling with a situation.
Focus on your physical health, on your sleep, on your exercise, on a good diet. Second, focus on relaxation activities, whether it is, um, pranayam, or whether it's breathing or meditation, or just reading a book of that you enjoy. Focus on inculcating a hobby that gives you joy, that gives you some distraction. Um, Find a group of like minded people that you enjoy spending your time with. So, basically, anything, and it could be different for different people, but anything that makes you feel worthy, that makes you feel valuable, that makes you feel like you matter is a tip worth exploring, and it could be different for different people.
Sure. Anubha, over to you again.
So, thank you again for this wonderful session, both of you. And I would also like to express my sincere gratitude to patron Shri Sim Limited and associate Kahali. Last but not the least, a big thank you for the most receptive audiences, without whom the chat session would not have been successful. So thank you all, and we'll
Thank you.
see you.
Thank you, Advaita. Thank you, Anubha. It was a pleasure. And like
Thank
I
you.
said, even if we could have impacted one life, I think we have
Absolutely.
succeeded today in our talk.
Absolutely, and I want to thank Prabha Khaitan Foundation, of course, for bringing these very interesting sessions, which are helpful, inspiring, and just open up new vistas for all of us, including me. I have so many questions on so many things, and I get an opportunity to ask them without being interrupted like you are in news debates. So this is lovely. And, we'll be, of course, back with the next Tête-à-tea with someone interesting and helpful and kind, like Parul is kind. I'm not sure the next person will be that kind, but but we'll
All
try.
we need all kinds.
All kinds make up the world. Yeah, exactly. And remember that this conversation is going to be on uh, this channel at all times. So feel free to come back and share it with people who you feel will be helped by it. This is something I'm afraid is not topical, so it's part of our lives, and I think this was a really helpful conversation, and I'm
Very.
sure a lot of people need to listen to it. So thank you so much, and see you soon. Thank you so
See you
much.
Have a great
soon.
evening,
Thank you,
all of you.
Anubhav. Thank you,
Thank you.
Advaita.